Thank you. So I want to look from the veterinary perspective at where we are currently and where we might move forward. So what do we know? Well, we know that working as an equine veterinarian produces the highest prevalence of occupational injuries within any civilian profession. So higher than working in the construction industry, the prison service, or as a firefighter. We also, this comes from the Beaver study in 2014, we know that the average equine vet, is liable to sustain 7 to 8 work-related injuries that impede them from practicing. And the behaviour of the horse is frequently cited as a cause of many of these accidents. So I then went on and did my own survey of equine vets within the UK, of which 168 respondents were included in the final analysis. We discounted the ones which were from abroad and the ones which weren't seeing many horses in their day-to-day work. So the final respondents were seeing at least 20 horses per month. So I asked them about the prevalence of unwanted behaviours. And the figures here is a cumulative percentage for vets that have seen these behaviours at least a few times each month. So the top two were horses which are bargy, 95%, and horses that won't stand still, 92%. And of course, what is really interesting is these are things which represent poor training on the behalf of the owner. You know, these are things that can be very easily fixed with some basic training. After that, 91% of vets said they were coming across horses which were needle shy at least a few times each month, 85% head shy, 84% clipper shy, 67%, so 2/3 of equine vets are seeing horses which kick out at them with the hind feet at least a few times each month. Again, we also looked at horses that pulled away, wouldn't load. 50% of vets seen horses which strike out with the front foot, and 49% of vets are seeing horses which rear at least a few times each month. So these are obviously very dangerous behaviours which horses are exhibiting when they're being examined or treated by a vet. I was interested to look at the injuries. Beaver looked at injuries as a whole. So they also looked at injuries due to, lifting things incorrectly and too much time spent driving. But I wanted to ask how many vets had sustained an injury as a result of a horse they were working with. So 81% of vets had sustained at least one injury in the past 5 years. And you'll see that 35% of them required a visit to hospital, 26% went to the doctor, 28% required some time off work, but incredibly, 51% have continued discomfort or loss of function as a result of an injury caused by a horse they were working with. So I then asked how frequently they perceive that they put themselves in a potentially dangerous situation when working with horses. And again, you can see 29% said every day, 67% said either every day or a few times each week, and 92% was saying those or a few times each month. So again, the majority of vets which work with horses perceive that they're putting themselves in a dangerous situation at least a few times each month. So I was then curious to see how much vets actually understood about learning theory in horses and some of the reasons that these behaviours might occur. So we asked the vets if they understood the following terms. First of all, I just asked them if they understood how well horses learn, and they all said yes, and how well they thought they could apply that. And again, the majority of them said yes. So I then looked at specific terminology. And you'll see 83% of vets were happy that they understood the term positive reinforcement, 79% negative reinforcement, a little bit less for positive and negative punishment. Habituation, again, they were fairly confident with that, 77%, and then classical conditioning, again, kind of in the middle, 57%. But then I tested them. I actually gave them scenarios and said, does this term correctly describe positive reinforcement, negative reinforcement? And in the interest of time, I won't go through all of these, but I'll look at some of the most interesting ones. So of the 83% of vets which said that they understood the term positive reinforcement, only 17% were able to correctly identify whether the term was correct or not. Of the 79% of vets who said that they understood the term negative reinforcement, only 33% were able to correctly identify the term. So this suggests that vets actually have quite a poor understanding of learning theory in horses. So the conclusions for the first part of the study was that equine veterinarians are frequently having to deal with horses that are exhibiting unwanted and often dangerous behaviours. And a lot of these behaviours could be prevented if the horses were trained and handled properly by the owners. But at the same time, vets have to take some responsibility themselves as well. Injuries are very common in equine vets, but they have a very poor understanding of equine learning theory. So that led me on to the second part of my research. And this was looking at whether undergraduate teaching could help improve the situation. So the 5-year veterinary degree, I'm sure you all know, at the University of Edinburgh, we have about 160 students in each year. So I took the students at the end of their 4th year. The final year is entirely practical based, so the 4th year is the last time that they get lectures on a regular basis from us. And the first thing I did was give them an online survey which they had to complete, and this had 5 different scenarios on it. And they would be given, so for example, one scenario would be you're asked to go and vaccinate this horse. When you arrive, the owner warns you that the horse is needle shy and you have to be quick. And then this is what you find. And I'll then show them a video of someone approaching a horse to inject it and the horse rearing up. So I then asked them about what they thought caused these behaviours, and unsurprisingly, a lot of these students said that they thought it was because the horse was dominant, because they had to show better leadership skills in these scenarios, because the horse was naughty, lots of different things. I then asked them how they might deal with these situations, and they could choose and say how effective they thought different scenarios would be. So we'd have the usual things such as putting a nose twitch on the horse to inject it, but we also put some crazy ones in, such as tying a front leg to a back leg to stop the horse rearing, and frighteningly some students thought that maybe that would work quite well. And then the 3 things which I was really interested in. So at the end of each scenario, I said to them, how likely do you think the risk is for injury? How likely do you think you are to succeed in vaccinating this horse? And how confident would you be as a new graduate if you're in this scenario? So after they'd all completed this, we then gave them a 45-minute lecture on learning theory in horses, and the application of learning theory to the veterinary environment. These students then went away on their holidays, and a few weeks later they were sent an email where they were asked to fill in the same scenarios again, exactly the same scenarios. So this was the delayed test, and then we also did a post-delayed test. And this was done at the end of their time in the equine hospital. So the students spend different amount of time rotating through the different departments, and they spend 4 weeks in the equine hospital. I may or may not have been on clinics with these students. They may or may not have come across behaviour cases, behaviour referral cases that we're dealing with. But they all had to look after the horses in their care. So at the end of this, they were then asked to complete this survey again. So what were the results? Well, we got 33% of the students to complete all 3 questionnaires. And interestingly, so these are the kind of scenarios. So scenario 1, refusing to enter examination stocks. And you see the first line is always confidence. And the confidence of the students increased not only after the lecture, but also after they'd spent some time in the equine hospital, and some of them were using some of these techniques. The likely injury risk, again, continued to decrease, and the likelihood of success continued to increase. And this was significantly different from if you compare the pre and post and the pre and delayed post for all 5 scenarios. So we know that just a small intervention can help students feel more confident, and what I found was really interesting was it wasn't just that they felt confident after they'd actually seen the lecture, but they actually felt more confident after they'd been in the equine hospital. And one of the things I wondered was whether these students would go into the equine hospital and come across some of these challenging horses and then actually become less confident again, but they didn't. Just through giving them some basic education, they were able to then start to apply it. 37 students left comments for us. We got some fabulous comments from the students, but of those, 13.5% said that the lecture gave them more confident to work with horses and made the equine hospital safer. And the students which were saying this tended to either say, I've worked with horses all my life, I've grown up in the racing industry and I've never come across this before. I'm really pleased that I can now go and apply this to different scenarios. But also there's a lot of students, and we take students from all around the world, which said, I've never come across horses before I've come to vet school. I was absolutely petrified of them, but I now feel more safe to work with them. 24% said that they had successfully used the techniques themselves. the equine hospital, and a lot of them, some of them sought advice from me for using these techniques, some of them sought advice from some of the grooms, but some of them actually just got on with it and would use things for taking horses' temperatures, listening to gut sounds. And 54% said that they wanted more lectures on how horses learn. They thought it was something that needed to be prioritised within the veterinary curriculum. So from that, I would like to conclude that teaching students about equine behaviour, and especially how horses learn, can increase the confidence of students. It may, we don't know yet, but it may reduce injuries as they have alternative ways to deal with these behaviours, and it makes life for the vet and the horses less stressful. And interestingly, I've had emails from students which have graduated and gone on, a year, 2 years down the line, and said that they've put some of these techniques into place with horses which the partner, always had to be the one that went out to do it, and even then it was very dangerous, or a horse that they hadn't been able to deal with in the practice for many years. So it's nice to see that they seem to be retaining these skills and continuing on. So what were the kind of areas of this lecture which I focused on and which I think are the most important thing? Well, I think there's 3 things which, if we could teach anyone that interacts with horses, whether it's a horse owner or a vet or a farrier, I think these are the 3 things that for me make the biggest difference. And the first one is understanding negative reinforcement. I often start to describe this now as removal reinforcement, because people seem to be able to get the concept of removal of pressure when the correct behaviour occurs a lot easier than they do negative reinforcement. Shaping different behaviours, and as Nat touched on, looking at arousal levels. So this is one of the scenarios which we showed in the lecture. And we often think about negative or removal reinforcement as being something that we use to train horses. So we can apply pressure to the horse's sides, the horse moves forwards, we release the pressure. But what a lot of people don't really think about is how this is training horses to do things that we don't want them to do. It is almost always negative or removal reinforcement that underlies the mechanisms by which horses become more difficult and dangerous. So let's take the example of the horse that's aversive to oral medication. And I try to explain to the students that every time this syringe comes into contact with the horse's mouth, the horse removes it by jerking its head back, and each time it does it faster and further. So you can see how we train that reaction. So of course then we teach the students that the way to do this is to keep the syringe in contact with the horse's mouth until the horse becomes calm and relaxed, and then remove it. And of course you'll all have noticed by now this is actually combination reinforcement, because we're using some positive reinforcement in the form of clicker training as well. But we have a lot of horses in the hospital which receive oral medication that can't receive any food. So the students have actually become quite adept at just using negative reinforcement. And trying to get the students to see that each time we do this, the horse is becoming more and more relaxed. So previously, the behaviour it was offering was throwing the head up in the air, the arousal levels were becoming higher, it was becoming more fearful, it was becoming more dangerous, because that was the behaviour that's being rewarded. Whereas now the behaviour that's being rewarded is actually to stand still and relax and be calm. And this is something that I often describe to horse owners, whether it's a horse that's needle shy or a horse that doesn't like oral medication, and saying, well, from the horse's point of view, the horse thinks, God, that stupid blonde woman, she's really stupid. All the other vets I had to rear up to make them, take the syringe away from her mouth. This one I just stand still and relax, and the syringe goes away. And very quickly you get to the stage where these horses will tolerate the medication. And it's quite nice that some of our vets now will stop. Maybe they're going to put a needle in a horse to nerve block it or something, and they'll stop and go, I'm teaching this horse to kick at me, aren't I? How can we do things differently? So understanding that negative reinforcement is what's training these unwanted behaviours, stopping what you're doing and then thinking about how you're redoing it. So the next thing, of course, is to think about how we shape different responses. So this was a horse, and I go out, I deal with a lot of ridden problems for clients and things as well, but this is a really common one, and we all know that a lot of accidents happen when people are actually trying to get on or off horses. So again, getting people to understand that this horse is not dominant, it doesn't think it's the herd leader, it's not naughty, but by moving its hindquarters to the right, it removes the pressure of the mounting block each time. So how do we retrain that? Well, trying to get people to think about retraining things in several different stages, breaking it down into easy responses regardless of what it is that you're doing. So we need the hindquarters to go to the left. So the first thing we'll do is we'll stand on the right hand side of the horse and teach the hindquarters to go to the left. As soon as they do, of course, we release the pressure. But of course, we want to be able to get the hindquarters to come towards us. And we'll start off, you'll notice we start off doing it against a wall. So it's easier for the horse to yield the hindquarters to the left because there isn't really an option to swing them to the right. We can reach over again. As soon as the horse yields the hindquarters, we stop. A bit of positive reinforcement in terms of a scratch. And then take the horse up to the mounting block and start to play with that at the mounting block. And I actually get these horses, I just walk them straight up to it so they're at 90 degrees. And then just looking at any attempt to move the hindquarters out to the left. And reward each little step. We're not asking for too much initially. We're not trying to get the horse really close to the mounting block. That's fine. Any attempt to come up and move them across. And by breaking it down into really little easy responses, it's easy for the horse to get the right response without its arousal levels becoming higher, without it becoming fearful. And then we slowly just ask for the horse to be closer to where we want it to be and to stand still. We may reach over and offer the horse a little bit of food from the other side. And then we can get the owner to also work on these things. And we use the same shaping principles, whether it's dealing with a needle-shy horse, a horse that doesn't like oral medication, doesn't like having their temperature taken, a horse that bucks when they go into the canter transition, anything. You just need to think about breaking it down into really easy responses. And once people start to see that, people can then train. And I'll get a lot of people which will say to me, well, okay, I've got to this level, but I can't get to this level. And it's get them to understand that there's always a step in between. And then the third and final thing is to think about the arousal levels in horses, because this is something that's not trained very well. And unfortunately, as someone's already said already, a lot of things are seen as normal. A lot of people would say this horse is playful, excited, and it may be, but a lot of these things are accepted. A horse that gallops at jumps, a lot of people say, oh, well, he's just really keen, he's just really excited to gallop at the jumps. But actually seeing that when horses are in a very high state of arousal, that is when they're more likely to react adversely and when people are more likely to be injured. So we will get our vets now to look at a scenario like this and say, well, the horse's poll is at a very high point, the ears are back, there's tension in the muscle, then there's tension in the neck. You would not want to put a needle in that horse because the chance of that horse exploding is really high. And again, it amazes me how many times people say horses are unpredictable. This just came out of nowhere. I have yet to see an accident come out of nowhere. I don't find horses unpredictable. I just think we accept certain levels of fear and arousal in horses, and when they're in that, they're really highly likely to explode. Whereas once we start to get horses more calm and prioritise a calm response as part of the shaping response, these responses just disappear from horses. And even horses, we'll get some horses in that are really needle shy and they may still go to rear or something, you know, when we actually put the needle in. But actually it's quite slow and controlled and they kind of rear and step backwards. And I mean, they're very rare, these horses now, but we get a lot of horses in and we'll see maybe 2 or 3 a year that will still have this little response, but it's all slow and controlled. And that's because we've prioritised the arousal levels throughout that. So, thank you. Any questions?